We have to go after a complete repeal. And that's going to have to happen. That's going to have to happen with a House and a Senate, hopefully that are Republican. If we don't have a Republican majority, I think we're going to be able to convince some Democrats that when the American people stand up loud and clear and say, we do not want Obamacare, we do not want the higher taxes, we do not want a $500 billion cut in Medicare to pay for Obamacare, I think you're going to see the American people stand with our president and say, let's get rid of Obamacare. But we'll replace it. And I've laid out what I'll replace it with. First, it's a bill that does care for people that have pre-existing conditions. If they've got a pre-existing condition and they've been previously insured, they won't be denied insurance going forward. Secondly, I'll allow people to own their own insurance rather than just be able to get it from their employer. I want people to be able to take their insurance with them if they go from job to job. So we'll make it work in the way that's designed to have health care act like a market, a consumer market, as opposed to have it run like Amtrak and the post office.
Can you get it repealed in total? Sure. You have to elect a House, a Senate, and a president committed to that. It has to be a major part of the fall campaign. And I think that, frankly, on our side, with any of us, it's going to be a major part of the fall campaign. The American people are frightened of bureaucratic, centralized medicine. They deeply distrust Washington, and the pressure will be to repeal it. And a lot of what Governor Romney just said, I think, is actually pretty good, sound stuff for part of the replacement. I would always repeal all of it because I so deeply distrust the congressional staffs that I would not want them to be able to pick and choose which things they kept. But let me make one observation. You raised a good example. Why is President Obama for young people being allowed to stay on their parents' insurance until 26? Because he can't get any jobs for them to go out and buy their own insurance. I have an offer to the parents of America. Elect us, and your kids will be able to move out because they'll have work.
These are two folks who don't present the clear contrast that I do, who was the author of Health Savings Accounts, which is the primary basis of every single conservative reform of health care. I was the author of it back in 1991 and 92, 20 years ago. I've been fighting for health reform, private sector, bottom up, the way America works best for 20 years. Well, these two guys were playing footsies with the left. The core of Obamacare is an individual mandate. It is what is being litigated in the Supreme Court right now. It is government top-down telling every business and every American what kind of health care that you will have. That is the problem with Obamacare at the core of it, and the Speaker supported it repeatedly for a 10-year period. So when he goes and says, I can, run rings around President Obama in a Lincoln Douglas debate, you can't run rings around the fact, Newt, that you supported the primary core basis of what President Obama has put in place.
Look, just one
quickly,
brief
Mr. Speaker, Congressman's getting lonely down here. Let's go.
Just one brief comment. Of course you can. I can say, I was wrong and I figured it out. You were wrong and you didn't.
The gentleman asked whether he thinks we can repeal Obamacare. Theoretically, we can. The likelihood isn't all that good. We can diminish some of the effect, but I'm more concerned about a bigger picture of what's happening, and that is government involvement in medicine. I had the privilege of practicing medicine in the early 60s before we had any government, and it worked rather well, and there was nobody out in the street suffering with no medical care. But Medicare and Medicaid came in, and it just expanded. But even when we had the chance to cut back on it, when we had a Republican Congress and a Republican president, we gave him prescription drug programs. Senator Santorum supported it. That's expanding the government. So it's endless. And most of them are bankrupt. Prescription drugs, they're not going to be financed. Medicare is not financeable. Medicaid's in trouble. But nobody talks about where the money's going to come from. Now, even in my budget proposal, which is very, very tough because I'm going to cut $1 trillion the first year, but I try to really, even though these programs should have never started, but a lot of people are dependent on, I want to try to protect the people who are dependent on medical care. Now, where does the money come? My suggestion is look at some of the overseas spending that we don't need to be doing.